Hello friends, let's today talk about what is TLIF surgery or Transforaminal Lumbar Interbody Fusion surgery in spine. So first of all, let's understand where this lumbar spine is. Lumbar spine is the lower part of our spine, the lowermost. Normally we call it as the lower back of our spine. So lumbar spine typically has 5 vertebrae or 5 building blocks. When we want to fuse one of these vertebrae, by fusion we mean that when we want to join 2 vertebrae and make them one, we do a surgery known as fusion surgery. In that, there is one specific surgery which is known as TLIF surgery, which stands for Transforaminal Lumbar Interbody Fusion surgery. This surgery is done through a minimally invasive technique or a microscopic technique, in which we put implants in the form of screws to stabilize the spine. We normally, if we want to stabilize 2 vertebrae, we put 2 screws in each vertebra. We put rods on either side to stabilize the spine. Now, in TLIF surgery, we go through the area which is known as the foraminal area, and through that foraminal area of the spine, we put one cage or spacer between the vertebral bodies. The advantage of putting this spacer is that it increases the space between the 2 bones. It provides a solid support to the front part of the spine, and also the fusion rates are better. The fourth and the most important point in this procedure is, or the advantage in this procedure is, that when we go through the foraminal area, we make the nerves totally free. There are 2 nerves at each level. One is the exiting nerve and one is the traversing nerve. Exiting nerve is the nerve that is coming out of the spine at one particular level. Traversing nerve is the nerve that travels from that particular level of the spine. So when we do TLIF surgery, since we open up the space for the nerves, both these nerves, they become free. So the advantage of TLIF surgery is the space between the bone increases, the chances of fusion becomes better, nerves, they become totally free from any sort of pressure. And when we remove the disc entirely and we put bone graft or the spacer in place of that, we remove any possibility of disc prolapse in the future or recurrent disc herniation. So in simple, TLIF is a specialized form of lumbar spine fusion surgery which is very commonly done. It can be done through a minimally invasive technique in which we do not cut any muscle. Bone loss is also very minimal. The blood loss is very minimal. Patient rehabilitation is better. Patient can stand up faster, walk better. Or it can be done through a microscopic technique where we give a central midline incision and the same procedure can be done. In this procedure, to some extent muscle damage is there, but study shows that after a few months the results are equal for both the procedures. So if your doctor has advised you TLIF surgery, don't worry. It is a time-tested and successful procedure which can be done if you have spondylolisthesis or recurrent back pain or recurrent disc herniation. It is a very nice procedure for taking care of these pathologies. Thank you.